my name's Grace. I'm one of the nurses at Healix. Today we're going to have a whistle-stop tour of our medical kit room, what's involved with medical escorted repatriations and how we get patients back safely. We're managing cases all around the world where they have become unwell somewhere that's not their home country. So we are assessing what their diagnosis is, what treatment they're having, if that treatment is appropriate, and then a window of opportunity to bring them back to their home country. And often, because of their diagnosis or their condition, they are not fit to fly unless they're travelling with a medical professional. Once the assessment is made that the patient requires a medical escorted repatriation, then all the medical information will be sent to the escort. They then call us and we can have a conversation over the phone and talk about what they may need to make sure that trip is successful and they've got all the equipment that they need to manage the patient in flight. We have two different bags. One is a doctor's kit bag and one is for the nurses. They both have a standardised kit. However, depending on the patient's medical condition, we may need to add certain pieces to ensure that the patient is safe in transfer. Essentially, the kit is there to mitigate any risk of deterioration. We have a lot of kit inside, varying from airway equipment, dressings, fluids, drugs, catheter equipment. Each bag is exactly the same and each pouch is sealed, so we know that everything is in date, and if anything is opened during the repatriation, then the whole bag would need to be rechecked. The doctor's kit bag differs from the nurses in that there's more advanced equipment inside, especially with the airway equipment and the drugs, and a doctor would have been selected for a trip, for example, cardiac cases, post heart attacks. Most airlines have an emergency oxygen cylinder on board for any emergency situations, but if a patient needs continuous oxygen in flight, then the escorts would carry a portable oxygen concentrator, which looks like this. Some airlines allow patients to be repatriated in a stretcher. It's only some airlines that provide this because they have to block out 9 to 12 seats, put the seats down, and then the stretcher is attached to the top of those seats, and the medical escorts would need to bring the stretcher with them. Often overseas hospitals are not aware of aviation guidelines and that we can provide a medically escorted repatriation to get a patient home. So treating doctors may say the patient's not fit to fly, and we would agree they're not fit to fly unescorted, but they may be fit to fly with a medical professional that can provide oxygen, IV medication, analgesia in flight to manage their condition. We always provide a door-to-door service, so the escort will be taking them either back to their home address or to hospital. If the patient requires a hospital admission, then that will be organised prior to the repatriation. The escorts will hand over directly to the nurses or the doctors and provide them with all of the medical information that we've been given throughout the process of them being admitted overseas.